Hello and welcome. Let's talk about tolerance, dependence, and addiction. So, what does it mean by tolerance or dependence? Now, let's talk about drug abuse first. Inappropriate and usually excessive self administration of the drug for non medical purpose is known as drug abuse. Misuse of drug can be considered when a drug has taken as a wrong indication, wrong doses, or for wrong period. Now, drug dependence can be defined as a repeated compulsive use of a drug in order to retrieve its chemical rewarding effects or to avoid punishing effects of the drug withdrawal. It is characterized by psychological dependence or habituation, physiological dependence, and tolerance. Now, psychological dependence or habituation. It is now definition states that the compulsive drug using behavior in which the individual uses the drug for personal satisfaction, often in the face of the known risks of health. The example includes heavy cigarette smoking, tea or coffee taking. Now, habituation. This state is characterized by the desire to procure the drug or item but not compulsory. Tendency to increase the dose may be present or absent. Dependency is only psychological and not physical, and the harmful effects only to the individual but not to the society, and there is no withdrawal or abstinence syndrome. Now, physiological dependence. Taking a drug to avoid withdrawal symptoms is described as physiological dependence. The effects. A tendency to take the drug to avoid the punishing effects of its withdrawal, neuroadaptation leading to reduced effects of the drugs on the brain, and increased withdrawal syndrome that include signs symptoms opposite to those induced by the drug. Now, tolerance. It is defined as the gradual diminution of the response due to repeated administration of the drug. Criteria includes larger doses is needed to achieve the same effects. Physical dependence develops along with tolerance. Larger with intervals and develops more tolerance, and degree of the tolerance usually proportional to dose and duration of the use of drugs. Now, types. These includes pharmacokinetic or metabolic tolerance, whether it is tolerance due to the metabolic changes, pharmacodynamic or cellular or functional tolerance, where tolerance due to changes in the receptor or effector system involving the drug action, and behavioral tolerance, where there is an inability to compensate for drug action. Now, mechanism of tolerance and dependence is not known, but it is believed to be cellular adaptive response that is associated with changes in the second messenger system, decreased number of receptors, decreased synthesis of receptors, and changes in the receptors shape and size. Now, addiction. This is an extreme form of dependence with chronic intoxication due to repeated administration of a drug and characterized by overpowering desire to procure the drug, tendency to increase dose, physiological as well as psychological dependence, bad effects to the individual as well as to the society, and withdrawal syndrome if the drug is not supplied to the individual. Now, withdrawal symptoms. It is a state used to describe the signs symptoms that occur in the withdrawal of a drug in a physically dependent patient. The signs and symptoms include rhinorrhea, lacrimation, yawning, chills, goose flesh known as pylorexia, and hyperventilation, hypothermia, mydriasis, muscular aches, vomiting, diarrhea, anxiety, and hostility. Now, treatment of the dependence and addiction. Withdrawal of drugs, use of alternative drugs like methadone for heroin, morphine and pethidine, benzodiazepine for alcohol, nicotine patch for cigarette, and to decrease sympathetic activity, beta blockers, clonidine can be used. To decrease severe pain, NSAID can be used, and combined psychological treatment should be attempted to decrease the craving of a specific drug. Now, drugs causing dependence and addiction includes morphine, pethidine, heroin, barbiturates, amphetamine, cocaine, alcohol, tobacco, benzodiazepines, nicotine, LSD, marijuana, inhalants like gasoline, kerosene, toluene, carbon tetrachloride, amyl nitrate, and nitrous oxide. End of the topic.